Welcome everyone to Workflow Excellence. My name is Tanya Davis, and I am one of the moderators, as well as a facilitator and trainer for the HRSA Cancer Screening Acceleration Program. We have our other amazing room moderators here, Jessica Roberson, Nakel Weathersby. Wow, I'm forgetting Nakel's name. Nakel, who will also be working the chat. And we also have August's team. So we have a great team here to engage and support you and answer any questions that you have. So please feel free to put those in the chat box, and we'll be sure to address any questions or technical difficulties you may have. So I must say that I am absolutely delighted today to introduce our featured speaker, who brings exceptional expertise to health centers and organizations to address their operational challenges and barriers with the goal of enhancing patient care and outcomes. Today's presentation on workflow excellence comes at a critical time when HRSA-funded health centers are facing increasing demands for operational excellence, regulatory compliance, and demonstrable quality outcomes. Our speaker today is uniquely positioned to guide you through proven methodologies that can transform your healthcare facilities. Let me introduce Vaughn Barker, a distinguished former U.S. Navy officer, Lean Six Sigma expert, and healthcare process improvement consultant with extensive experience in helping healthcare organizations achieve operational excellence. Vaughn brings a powerful combination of analytical expertise, healthcare industry knowledge, and practical implementation experience that has helped numerous healthcare organizations improve patient satisfaction, streamline their processes, and reduce waste. He has successfully guided organizations through systematic process improvements using tools and methodologies specifically designed and enhanced for healthcare delivery. Now, what makes today's presentation particularly valuable is Vaughn's ability to translate complex improvement concepts into actionable strategies that your team and everyone here can go back and implement immediately in your various health centers. So without further delay, I introduce Vaughn, who will share invaluable insights on transforming your health center's operations through workflow excellence. Before we bring Vaughn up, I want to note that this is a CME accredited event. If you are planning to claim CME credits, please pay attention to the chat box. There will be a link that will lead you directly to the CME portal so that you can receive credit today for your hours spent. So please remember, this is a 1-hour CME accredited course, and you will be able to access that link to claim your CME credits at the end of this event. We will provide you with a code that you will need to enter the portal. So let me go back, and we're going to bring now Vaughn Barker to the stage.
Thank you. Hello, I'm Vaughn Barker, the CEO of Barker & Barker Consulting. HRSA's 1,400 health centers are the front line for 32.5 million patients every year. Each workflow excellence idea we discussed today can directly advance HRSA's mission to improve health outcomes and achieve health equity. Today, we are addressing one of the most critical challenges facing your health centers: the devastating impact of process variation on patient outcomes and operational efficiency. Standardizing clinical workflows isn't just an improvement opportunity, it's an imperative for delivering consistent, high-quality care to the communities that depend on you. In plain language, workflow excellence means one proven best way to do a task or series of tasks so every patient receives the same safe, efficient care regardless of day, location, or clinician. Standardization eliminates dangerous variation and respects each specialty's clinical nuances. Before we dive into today's session, I ask each of you to take 2 minutes to complete our 4-question workflow excellence survey. Here's why it matters. Just as you wouldn't treat a patient without first assessing their vital signs, your organization can't improve its clinical workflows without understanding where starting from. These questions will help establish a baseline, a clear, objective snapshot of your current familiarity with workflow excellence, your organization's use of standardized care processes, and your confidence in identifying workflow efficiencies. This is not a test. There are no right or wrong answers. The goal is to capture your real-world experience so I can tailor the webinar approach to topics that will give you the most impact. And your input is anonymous. So please take 1 to 2 minutes now to complete the 4-question survey. One thing I will let you know is that your participation in this survey sets the foundation for meaningful dialogue. And for those that responded, I thank you for your engagement and your commitment to excellence. And I thank you all for your responses. By the end of today's session, you will be equipped to identify, apply, and implement tools, methodologies, and strategies to standardize care processes for consistent, high-quality outcomes. As it relates to identifying high-impact areas, I will show you how to analyze key processes within your clinical setting to pinpoint areas that will deliver the greatest benefit from standardization, directly improving efficiency and patient outcomes. This is discussed in detail in slide 6. As it relates to applying proven process improvement tools, you will learn to leverage Lean Six Sigma methodologies, PDSA cycles, and other data-driven approaches to streamline workflows and eliminate unnecessary variation, while preserving the adaptability your clinicians need. These topics are discussed throughout the presentation. And lastly, as far as implementing sustainability practices, I will share strategies to embed standardized workflows into your organizational culture, provide ongoing training and support, and continuously monitor adherence to maintain improvements over time. These are discussed on slide 7. By implementing and teaching process improvement principles over the past 25 years, I have been able to help healthcare organizations unlock the power of standardized clinical workflows, driving consistent, high-quality care and enhancing the overall patient experience. I look forward to sharing some of this knowledge with you today. Let me start with a scenario that happens in health centers every day, illustrated perfectly on this slide. 2 patients present with identical conditions. Patient 1 experiences an efficient flow, arriving, being triaged quickly, seeing the clinician promptly, receiving coordinated care, and leaving satisfied. Patient 2, presenting on a different day or with different staff, experiences delays, redundant processes, poor communication, and ultimately suboptimal care. Patient 2 experience shows up as low colorectal cancer screening adherence and a complaint in HP25 access measures. Workflow excellence isn't about clinical competence, it's about process variation, and the data shows its devastating impact. I will share a financial impact example that directly addresses the access to care challenges that most HRSA clinic leaders face daily, the third next available appointment metric. It represents one of the biggest operational challenges and a prime target for systematic process standardization. The national primary care TNAA is 38 days, yet many HRSA centers exceed 50 days. Each extra week pushes 8% of patients to the emergency department at 4 to 10 times the cost. Extended appointment delays create a cascade of costly consequences. HRSA-funded clinics face unique challenges affecting TNAA performance: higher patient complexity and social determinants of health, limited clinician availability in underserved areas, increased demand from uninsured and underinsured populations, and resource constraints affecting scheduling efficiency. When patients can't get timely appointments, they inevitably turn to emergency departments for routine care. Research shows that timely primary care access reduces emergency department visits by up to 40%. The expanded hours funding project helps in that it increases health center operating hours to meet identified patient and community needs. HRSA may be able to achieve additional reductions in TNAA times by using Lean Six Sigma methodologies to standardize and optimize the scheduling process. And here's a personal example of this. When two healthcare systems merged, there was extreme variations in the clinical scheduling process. The combined system decided to centralize the call centers into an engagement center. It was very difficult for the engagement center representatives to schedule patients across the system due to variance in clinician scheduling requirements. Some clinicians schedule 45-minute appointments for physicals and 20-minute appointments for anything else. Some clinicians had different appointment times based on the condition that was to be treated. Some clinicians blocked and released their schedules at will. The system leadership decided to use Lean Six Sigma methodologies to systematically address the scheduling standardization challenge. This led to remarkable results across multiple dimensions: patient access improvement, revenue generation, clinician satisfaction, and operational efficiency. The Institute of Healthcare Improvement has documented that standardization is fundamental to improvement work. As they state, you must standardize before you improve. This isn't about removing clinical judgment. It's about creating reliable systems that free clinicians to focus on patient care rather than navigating inefficient processes. Before we dive into workflow standardization solutions, I want to understand your current situation. What's your biggest workflow challenge? Please take 1 minute to respond to the following poll. And I thank you all for your responses. These results align with what we see nationally. And regardless of your specific challenges, the solution framework remains consistent. Prioritize systematically, engage stakeholders, and implement sustainable changes. Successful workflow standardization starts with strategic prioritization. You can't standardize everything at once. So how do you choose where to start? 1, align with organizational goals. Determining which processes to standardize is a critical decision. The wrong choice can waste valuable resources and create resistance to future standardization efforts. However, selecting the right processes for standardization can deliver transformational results that improve patient outcomes, reduce costs, and enhance operational efficiency. Your standardization efforts must support your health center's strategic priorities and mission, whether that's improving access to quality health services, fostering a healthcare workforce able to address current and emergency needs, or achieving health equity and enhanced population health. There should be a clear connection between the effort and the strategic goal that it is contributing to. We use the Hoshin-Conry methodology. It is a strategic policy deployment framework that systematically connects an organization's strategy to objectives, then to specific improvement projects. This ensures that every initiative directly supports a strategic goal, creating organizational alignment from leadership vision down to frontline execution, while eliminating the common disconnect between strategic planning and day-to-day operations. The second item to look at is using a prioritization matrix. When evaluating processes for standardization, you should systematically assess key factors to determine both feasibility and impact of standardization efforts. We score each process on clinical risk, volume and waste, and practicality, looking at items such as return on investment, data availability, and amount of resources required. After you create a list of potential processes to standardize, there are many ways to prioritize your list. One way is to rank the processes based on an impact versus effort matrix. This is a 2x2 matrix with the following quadrants: high impact, low effort initiatives. These give you quick wins that build momentum. High impact, high effort initiatives. These become your major transformation projects. These initiatives have more impact and take more time to complete. Low impact, low effort initiatives. These are simple, easily implementable tasks that require minimal resources and produce modest benefits. These fill-in activities can keep teams busy between major projects, but should never be prioritized over high impact opportunities. And then the last quadrant is low impact, high effort initiatives. These are resource intensive projects or processes that demand significant time, energy, and organizational commitment while delivering minimal measurable benefits. These are the strategic pitfalls that health centers must avoid because they drain valuable resources, exhaust team morale, and divert attention from high impact opportunities that truly advance patient outcomes and operational excellence. The third item is engaging stakeholders in co-design. This is absolutely critical for health centers. Your frontline staff, medical assistants, nurses, clinicians, registration staff, they know where the real problems are. There's a potential for three processes to exist: the documented process, the process management thinks happens, and the process that actually happens. It is best when all three are the same. This can be achieved by securing buy-in from clinicians, staff, and administrators through workshops and structured feedback loops. And the fourth item is target high-impact clinical areas. You should focus on processes with the greatest effect on outcomes and compliance. For most health centers, this includes patient registration, chronic disease management protocols, medication management, care coordination, and patient follow-up systems. Implementation is just the beginning. Some organizations have difficulty sustaining improvements long term. Research shows that without deliberate sustainability strategies, 70% of improvement gains are lost within 2 years. This is a key reason why some organizations continue to have to fix the same processes or their process improvement journey failed to live up to the expectation. Here's your sustainability blueprint shown on this slide. Each component you see here represents a pillar of sustainability that I've implemented across hundreds of healthcare projects. Tiered metrics. This isn't about having dashboards. It's about creating a 3-tier measurement system. At the process level, we track cycle times and defect rates with real-time feedback. At the outcome level, we monitor patient satisfaction and clinical indicators. At the impact level, we measure cost savings and staff engagement. This tiered approach ensures we catch variation before it becomes a problem, not after. Accountability frameworks. Notice how this emphasizes ownership and responsibility across the health center team. In my experience, sustainability fails when it's everyone's job and no one's job. It is best to establish clear process owners, typically someone who is responsible for the process, who becomes the guardians of the improved process. They are not just monitoring, they're troubleshooting, coaching, and escalating when needed. Standardized workflows are where the rubber meets the road. A best practice is to institutionalize the new way of working through visual management boards, standard operating procedures, and what I call new employee-proof processes. Every step is documented, every decision point is clear, and every variation to the process is intentional, not accidental. Ongoing monitoring represents data-driven feedback loops. You should implement measurement cycles. They should be short enough to catch problems early, yet long enough to see meaningful trends. When metrics drift outside control limits, you should have structured response protocols that trigger immediate investigation and correction. Then continuous improvement is the crown jewel, fostering a culture of plan, do, study, act cycles in which you want to become business as usual. Staff aren't just following procedures, they are actively seeking opportunities to refine and improve. A best practice is for organizations to empower frontline teams to test small changes and implement quick wins without waiting for formal project approval. Now, we'll say these small changes should be items that are easily reversible, just in case you don't want them to stay. Shared ownership. Finally, we cultivate shared accountability across clinical, administrative, and community-facing teams. This isn't top-down mandates, it's bottom-up engagement where every team member feels responsible for maintaining the gains and pursuing further improvements. The bottom line is, these 6 components create what I call a self-healing system. When one element detects a problem, the others respond automatically. Process variation triggers monitoring alerts. Monitoring alerts activates accountability frameworks. Accountability frameworks engage shared ownership. It's a closed loop system that protects your investment and multiplies your impact. This sustainability framework can help you achieve greater than 95% retention of standardization improvements at 18 months post-implementation. You don't want to just fix problems, you want to build systems that prevent them from recurring. As it relates to sustainability, one thing that we recommend is as the as the process is complete or as you're completing the process, start to think of what needs to be in place to sustain it. So don't wait to the end, say, all right, here's our process, and then or new standardized process, and just pass it on to the process owner. Make sure that there's a transfer of ownership of the process. Make sure you talk to the process owner about what you did to get to your conclusion. And also make sure you develop what we call a reaction plan, in which it lists different metrics or items that the process owner should look at and should monitor as time goes on, such that if those items get out of control limits, they already know certain action items or certain things to look at or certain people to actually get together to resolve it. Well, now, before going through this, I will address the elephant in the room: resistance to standardization. In healthcare, we hear 3 common concerns. I don't have time to learn something new. How will this help me care for patients? And will standardization attempt to erase my clinical judgment? As it relates to I don't have time to learn something new, this reflects workflow disruption anxiety. Staff are already overwhelmed, and the thought of additional complexity feels impossible. As it relates to how will this help me care for patients, this shows unclear benefits. If people don't understand the connection between standardization and patient outcomes, they won't engage. And as it relates to will standardization attempt to erase my clinical judgment, this reveals fear of loss of professional autonomy. Clinicians worry that standardization means cookbook medicine. It doesn't. Here's how I've seen health centers overcome these concerns. 1, align with clinician and team member values. Start by connecting standardization to what healthcare clinicians care most about: better patient outcomes, reduced frustration, and more time for meaningful patient interaction. Share data on how standardization reduces medical errors and increases direct patient care time. The second way is co-design with clinicians and team members. Never mandate from above. Instead, engage clinical staff in designing the standards. When a nurse practitioner helps create the diabetes management protocol, they become its advocate. And third, pilot, don't mandate. Start small and demonstrate success. Choose a willing champion clinician or department. Test the new process or the improved process with a subset of patients. Document the improvements, then communicate the success. And at that point, you let the success speaks for itself. The key insight is that people don't resist change, they resist being changed. When you involve them in creating the solution, resistance transforms into ownership. Now, let's get practical. How do you actually implement standardized workflows that stick? The framework shown here outlines 4 critical steps. Step 1, secure leadership commitment. Without visible, consistent leadership support, standardization efforts fail. Leadership commitment means more than approval. It means active participation, resource allocation, and consistent messaging. Step 2, identify and prioritize key processes. Using prioritization strategies that I discussed earlier, select 2 to 3 processes maximum for your initial implementation. Trying to standardize everything simultaneously guarantees failure. Step 3, leverage proven frameworks. Don't reinvent the wheel. Use established methodologies like Lean Six Sigma, PDSA cycles, Agile, or other proven process improvement frameworks. The skills needed to utilize these methodologies may be on your team or you may need outside assistance. And step 4, you could contact us for a free process maturity assessment. This online assessment includes a tailored report on your organizational readiness to standardize processes, as well as your level of process maturity based on the capability maturity model integration, which is CMMI framework. You now have the framework to transform your health center through workflow standardization. Standardization enables your health center to fulfill its mission more effectively and more efficiently, providing consistent, high-quality care to the communities that depend on you. Every patient who walks through your doors deserves the same excellent care, regardless of which day they come, which staff member they see, or which shift is working. Standardized workflows make that promise achievable, and we are here to support your journey. Now we'll have the last survey of the webinar. Now, if you could take 1 minute to complete these last 2 questions. So everyone, I thank you for your attention, your commitment to quality improvement, and most importantly, your dedication to serving our communities. We have time for questions, and I encourage you to use this opportunity, whether you're wondering about specific implementation challenges, seeking clarification on prioritization strategies, or want to discuss workflow excellence in general. Let's make these final minutes valuable for your improvement journey.
Okay, in terms of upcoming events, we have some exciting events in store. Starting off with Navigation Reimagined, strategies that move patients and screening outcomes forward. This will be part 1 of an 8-part series starting next week. So you guys can scan the QR code directly on the screen, or you can also click the link in the chat to register for this event. We also have a number of other events in store, including Outreach That Works. This will be held on Thursday, July 17th at 12:30. And then we also have our community-based partnerships that work with host Elizabeth Hart and Ben Odell. So that will take place on Tuesday, July 22nd at 12 p.m. noon. So super excited about these events to come. And again, we have the registration links in the chat for you guys to register today. I think there were maybe 1 or 2 other events to share. We have contextual considerations for a roundtable on July 24th, and you'll see that link in the chat. And then we also have building relationships in screening conversations that will take place on July 29th. So links to all of these exciting events are in the chat, and we look forward to your participation and engagement. Thank you all.
Thank you, Augustine, and thank you everyone who attended this session. We hope that you'll be able to take away some of the tools and information that you learned here. Share it with your team members back in your individual health centers. And of course, please let us know what you need. Are there other topics that you like us to bring up, to share? What else do you need in your health center? Other support? That's what we're here for. We're here to support you so that your health centers could reach your cancer screening goals, as well as your patient quality goals. So without further ado, if no other questions there, please, just one final reminder, this is a CME accredited webinar. So please get credit for the time that you spent here today. You walk away with new information as well as 1 hour CME credit. The link is in the chat here. So if you click the box Weitzman Educational Platform, that will take you to the CE account. Once you register for the CE account, you'll then be able to go in and claim your credit for the time spent today. Thank you, and we hope you enjoyed this session, and we look forward to you joining us at another webinar. Thank you.